So today we're going to be going over chapter 3. We're going to talk about everything in infancy and toddlerhood. We see rapid growth and development as we proceed through the toddler years. This is including but not limited to physical development and brain development. Most of us are born with about 85 billion neurons, the most that we will ever have. And as we get older, progressing through the toddler years, they will undergo this process where they make a lot of connections and you see a lot of dendrite growth. Thousands of new connections are made throughout infancy and toddlerhood. As this is happening, the next process is going to be synaptic pruning. So this is where those unused connections are pruned away to leave more space for the connections that are frequently used. You also see the development of myelin. This is a fatty substance or tissue that's going to allow those connections to travel faster. So still talking about brain development, you're also going to see development of the cortex during this time. The cortex is divided into two hemispheres, and those two hemispheres are divided into 4 lobes. The frontal lobe, which is responsible for planning ahead, that's going to be right here. This is the last lobe to develop. It doesn't really develop until we're about 25, 26. And before then, this process, while it's developing, this is what's helping us make rational choices. The parietal lobe, which starts in the middle of the skull and extends all the way backward, is going to be the part of our brain that's for processing information about touch. And then we have the occipital lobe, which is going to be at the back of the head, and that's going to be processing sight. And then we have the temporal lobe, which is not right here, but like sort of towards the back in the middle. It's going to be around your ear, and this is what's helpful for processing auditory information like language. The prefrontal cortex is necessary in order for us to plan ahead and also to accurately understand information, like as threats or what we need to be prepared for. Newborns typically require a lot more sleep, roughly about 16 hours, and this tends to decrease as they get older. They also spend a lot of that sleep in REM. Another concern of this period is something called sudden infant death syndrome. So this is where children die in their sleep and it's an unknown cause. There are things that can increase risk factors such as smoking, sleeping with fluffy pillows, sleeping with parents when they have like fluffy bedding. All of those things are increase the likelihood of SIDS. Something that has reduced it is something called the back to sleep campaign. So that's where you place a baby on its back to go to sleep, even though they don't really like that, like the babies, but it helps to reduce the likelihood of SIDS. Even newborns tend to prefer the shape of a face when it comes to their sight and their vision. They can't see very well. You have to get really close for them to see you, but they tend to prefer a face. They also tend to have a preference for their mother's face and start to try to recognize it really early on. Their sense of hearing, on the other hand, is usually well developed by the time they're born because they can hear while they're in utero. That's how they start to have a preference for the sound of their mother's voice. One of the biggest sensations that a newborn has is the sense of touch. So they have a hard time regulating their own body temperature, so they need touch in order to feel regulated. And also they actually have a sensation of pain, which we know from studies that look at children who have had circumcision. Those who were not given anesthesia when they had a circumcision tended to show more. The best nutrition for newborns is going to be breast milk, specifically colostrum. Right when they're just born, there's really nothing better for the newborn. That colostrum is full of nutrients and antibodies. And also because of the enzymes in the infants and newborn spit, as they breastfeed, it basically tells the mother's body what they need more of and what they're deficient in. They tend to have less stomach issues and tummy problems when they're infants if they are breastfed. They're also at a lower rate of developing SIDS. Breastfeeding is also helpful for the mother. It helps her uterine contract faster, and it also helps to reduce her risk of breast cancer and diabetes after she's had the baby. Malnutrition is extremely common worldwide. About 1 in 13 children is malnourished throughout the world. There are different types of malnutrition. There's the type of malnutrition from lack of food, but there's also something called non-organic failure to thrive, which has to do with not having a nurturing home environment. That can cause a child to be too small for their age or to show other developmental issues and physical issues. So Piaget looked at children like little scientists. They were always going around and trying to understand and investigate the world around them. Through that process, it allowed their brain to grow and develop. One of the things that he said children are constantly doing is this process of assimilation and accommodation. So assimilation means to add something into your existing knowledge, perhaps something very similar to what you've seen before, and you might assimilate it. So if you know what a horse is and then you saw like a different breed of horse, you would add that into your category. Accommodation means that you've never seen something before and you have to basically create a new category where this thing is. So for example, if I explained to my daughter about what horses were, but then she saw a zebra, she would have to create a new category to fit the concept of a zebra. So something else Piaget talked a lot about was the concept of object permanence, or objects exist even when they're out of our line of vision. So as babies, about 6 or 7 months, they start to develop object permanence, or when you hide an item, they will actually look for it. Before that time, when something is outside of their line of vision, they assume it's disappeared. Although infants can learn different skills, like they can learn how to move their foot to make a mobile move, they tend to experience something called infantile amnesia. So this is where we can't remember anything before the age of 3. So this is likely because the immaturity of our hippocampus, but this could also be because before the age of 3, we don't really use words to express our ideas. And once we do start using words, the memories that were encoded differently may be difficult for us to access. So let's talk about language. So there are different components to language and how we understand language. A morpheme is the smallest amount of language that has meaning. So this is going to be in any individual language, the smallest that we can use to describe meaning. So like the word re in English to mean replay or to play again or to do more than once is a morpheme. So we often use semantics and syntax when we're speaking in order for our words to have understanding across different people. Something else that we use when we try to communicate socially is this concept of pragmatics, or taking turns while we're speaking, or making sure that we say please and thank you, basically expressing socially appropriate things that we've learned in our language. As infants are learning, so as children are learning these rules of language, the first thing that they tend to do is coo, and then the next thing is babbling. So babbling is going to be sort of like nonsense syllables in their language, or the language that they were brought up around. And that babbling is going to vary depending upon where they are in the world. So first, children have an increased level of understanding, and then they start to use phrases on their own. And some of the first phrases that they use are something called halio phrases. So this is where the child says one word or 2 words, and they're meant to stand in place of a whole phrase. So instead of saying mama pick me up, they might say up. So how do children rapidly learn this information? There are 2 different approaches or camps. The first one is going to be a nativist theory. Basically, according to nativists, we have something called a language acquisition device, or LAD, this innate ability within human beings to understand and produce language. The support for this is that human beings learn language at such a rapid pace, it would be difficult to teach that level of learning. The next theory is something called the learning theory approach, basically saying that humans learn language because language is reinforced. So you say dada and mama because when you do, your parents give you a lot of praise or attention because you say those. Support for this is that without language exposure, often language does not develop normally. So without social exposure, there isn't a lot of normal language development with syntax and grammar and all of the rules that we talked about earlier. So let's talk about temperament and its relationship to attachment. So temperament has to do with the way that you behave right out of utero. So if you've met different babies, you know that different babies have different temperaments. Some are more easy babies, some are more slow to warm up babies, and some are more difficult. Easy babies means that you could put them in a variety of circumstances and situations, and they would still pretty much be easygoing. Slow to warm up means that they usually need like information before they're able to go ahead and do something. And difficult babies means that you have to keep things just so, otherwise they get angry, or they are difficult to soothe and comfort. Now, all of these babies can form secure attachment. It really also depends on goodness of fit. Or what that means is that in different situations, babies who really fit the environment that they're in, they tend to do better. But that being said, difficult babies often experience harder times with attachment because their parents don't know what they need to do so that the baby is comforted. So let's talk a little bit about attachment. So initially, people like Freud said that children were attached, or babies were attached to their parents because their parents provided either milk, which was both pleasing to the infant and which was necessary for their functioning. So I want you to watch the video by Margaret and Harry Harlow and then tell me which wire monkey the baby monkeys chose. So this is the last section, and we're going to finish up this section talking about attachment. So we've been kind of hinting at some of the rudimentary needs for attachment to form. So I want you to watch The Strange Situation. It's by Mary Ainsworth. There's a video attachment, and it basically goes through this process that they conduct. So they have children go into a room with their parent, and then after they play a little while, they're left with a stranger. And then when their parent returns, you look at the response that they provide to that person. So do they hug them? Do they try to get close to them? And are they comforted? So most children form a secure attachment and they're comforted by the presence of their caregiver. However, some children form an insecure attachment and their presence of their caregiver is not comforting to them. So they kind of pull away, or they act in a sort of surprising way. So either they pull away or they cry, or sometimes they won't even go by the caregiver. So to develop that secure attachment, you want to be warm and responsive to your child's needs. And as we talked about earlier, when we talked about kind of the different temperaments, those easy babies, usually it's easier to form an attachment because you can more easily meet their needs. So I want you to review those videos and you will be ready for the quiz.